Good afternoon. My name is Valerie Padilla. I'm a QI coordinator with Open Door Community Health Centers. I'm here today to talk to you about how Open Door increased their screening rates with the direct mailing of FIT tests and through receiving colonoscopy reports through a health information exchange. So the name of this workshop is Fiscal Sustainability. And let me tell you, there's not really a golden ticket in my presentation about how this is done, but really more about leveraging the tools that you have available to you to the best of your ability to make sustaining this kind of work possible, because really when it comes down to it, providing this care for our patients is really the best practice and what is most important. So a little bit of background about Open Door. Open Door is a federally qualified healthcare clinic that spans over 2 counties and 120 miles. We provide medical, behavioral health, and dental services. We have 10 clinic locations, 1 mobile medical van, and 2 mobile dental vans. To give you an idea of volume, in 2016, Open Door saw about 55,000 patients and over 260,000 visits. The EMR that we use is Epic through Ocean. So the objectives of the presentation today are to demonstrate the Ocean Epic enhancements that reduced time and cost related to bulk ordering and mailing FIT tests to our patients. We're going to describe how receiving colonoscopy reports through health information exchange improved the data. And we're going to share the data that shows the increased screening rate by FIT since implementing a direct mail approach and health information exchange. So first we're going to talk about the Ocean Epic enhancements. A little bit of background: Open Door participated in a research study through the Kaiser Center for Health Research called Stop CRC, and the purpose of this study was to increase colorectal cancer screening rates by mailing a FIT test directly to patients. So they developed with Ocean a variety of reports that we were able to use for the purpose of this project. The most valuable enhancement that we had access to was the bulk order for FIT testing. Our timeline on the Stop CRC study, it started in early 2014. We joined the study with Kaiser. And in October of 2014, we started mailing FIT tests to our intervention sites. So while we have 10 clinics at our location, 4 sites were involved in the study. There were 2 intervention clinics and 2 control clinics. So we started mailing to our 2 intervention clinics in October of 2014. In April of 2015, enhancements were implemented in Epic to include bulk order functionality. And then in March of 2016, because of the bulk order functionality, we were able to roll the direct FIT mailing out to all Open Door clinics. This slide just talks a little bit more about the bulk order report itself. So this report considerably reduced the cost and time associated with ordering FIT tests. The report criteria is what's listed here. Patients need to be between the ages of 50 and 74. They need to have had a visit in the last 12 months. They need to have a viable address in our EMR. Their health maintenance modifier must be set for FIT, not colonoscopy. Health maintenance modifier in our system is the section of our patient record that indicates to the care team what preventative health services that the patient is due for. In addition to having a health maintenance modifier for FIT, the patient should not have had a FIT ordered in the last 6 months, does not have a resulted FIT within the last year, does not have an outstanding referral for colonoscopy in the last year, does not have a colonoscopy completed in the last 9 years, and does not have a diagnosis of colorectal cancer, colectomy, colitis, or end-stage renal disease. Other reporting capabilities that we had access to through this study included birthday month reports. This is how we actually handled our mailing. So a patient has a birthday in the month of July, for example, they're due for a FIT screening. They're going to come up on this report if they meet the criteria that we just discussed on the previous slide, and they're going to be mailed a FIT test. We also had access to service area reports. These are available you can run them on a birthday month criteria, or you can use every single patient that's due. Since we have 10 clinics, this report is very, very big, but it would give us an idea of how many we would mail if we were going to mail to everybody in the month or everyone that was due. We also had access to a FIT bulk orders, which was the most exciting for us. There was also reminder reports built into the enhancements. So the patient receives a FIT test in the mail, they haven't returned the FIT test within 2 weeks, and we haven't received any return mail from the patient, meaning they have a bad address, then they would receive a reminder letter or a MyChart message. Then if the patient still hasn't returned the FIT test after that first reminder letter, the second reminder letter report allows us to send another reminder to the patient 2 or 4 weeks after the initial reminder was sent. We also had access to exclusions report. The exclusion report was very useful for us because it helped identify early on in the project with Ochin and Kaiser if there were any gaps in the reporting, if we were missing patients that we expected to have been appearing on the report, or there were patients on the report that shouldn't have been. And finally, we had the ability to run a FIT resulted in the last 12 months. So this report gives all FIT results regardless of how the patient was given the FIT test in the beginning, if it was through the project or if it was through in-clinic distribution, and it gives all normals and abnormals. This report is really useful for us because we use this for our monthly abnormal FIT follow-up audit. So this enables us to make sure that care teams and providers are following up on those abnormal FITs and referring the patient for colonoscopy, and there's a proper care plan in place for that patient. So this screen shows you a little bit of what it looks like to go through the bulk order process in our EMR. So the first screenshot that you see is how it appears in the library when you're searching for this report. So we use the birthday this month report like I talked about earlier. After you run the report, the process happens, and then you would see what appears in screenshot 2. So these are test patients, so obviously there's only 2. For us, depending on clinic size, we can range from 10 patients to over 100 patients per report. Once it's completed, you would click the box on the right-hand side that would highlight all of your patients, and then you would click the bulk orders button that you see highlighted in red in the toolbar. Then you would be brought to the third screen, and this is where the actual order for FIT is placed. So we are able to check the box that says use PCP as authorizing provider. So as long as the patient has an assigned PCP in Epic, our EMR, then that would be the authorizing and signing provider for the order. In the instance that the provider that the patient is assigned to has left or they're unassigned, then we add in our site medical directors to default as the authorizing provider. The user would then check the box next to fecal globin by immunochemistry. That's the test that we use at our clinic. And our EMR administrator worked really hard with Ochin and Kaiser to get everything set up in the background for what needs to happen on the ordering side to make this actually happen. And what you can't see on the screen is at the very bottom, there's a button that says add communication. So after the user goes through those steps, they're able to add the introduction letter that is sent with the FIT test to patients, and the FIT tests are ordered and the letters are generated all in one click. That takes about 5 minutes. And here we're going to talk a little bit more about the bulk order for FIT and the costs associated with that. So the chart below gives data for mailing 100 FIT tests. So we do not pay for our FIT at Open Door. Our lab coordinator worked really hard with our lab vendor, which is LabCorp, to get our test for no cost to us. We use the PolyMedco test, the OC Micro, and LabCorp was happy to give us those tests for free with the understanding that all of our FIT tests go back to them for processing, and we then pay the processing fee. The cost associated for mailing materials and postage per kit is about $279 each. So pre-bulk order functionality, it took about 3 minutes per individual order, which for 100 tests is about 5 hours. And with staff time of about $23 an hour, this was a total cost of $115 for just staff time. Then you add in the cost of the mailing material and postage, it brings your total cost to mail 100 FITs to $394. Post bulk order functionality, it changed the order time to 5 minutes per bulk order, so that could be for 10 FIT tests or 500 FIT tests. It takes 5 minutes. And with staff time at $23 an hour, it's about $1.92 to order 100 fit tests. That brings the total cost of mailing to $281 about. So our real savings here is in the time to order and the total cost to mail. So we save 4 hours and 55 minutes of staff time, which is about $113 per 100 fit tests. We order about 500 fit tests a month at Open Door, so this is about a $600 savings, which is pretty considerable for us. Now we're going to talk more about health information exchange. In our service area, all colonoscopies are done in a hospital setting. That made the implementation of the health information exchange a little easier. I say a little because it's not easy, but a little simpler because we have 3 hospitals that the colonoscopies are done at, and it allows us to work with our health information exchange and the hospitals to get that information to us. Many colonoscopies are done by patient self-referral, so since patients can go call the general surgeon or the GI on their own, we don't know to follow up on those procedures. We don't know that they've been done, so we're missing a lot of information sometimes for our patients. So the timeline for our health information exchange setup is as follows. In 2015, we started the programming. That took quite a long time, about a year. And then January of 2016, we began receiving HIE colonoscopy lists and reports. So through secure email, a contact at our HIE would send an Excel spreadsheet with the patient name, date of birth, MRN, and date of service. And then they would also include the colonoscopy procedure report in a separate file. In April of 2016, we started receiving colonoscopy reports through HIE as scanned documents. So they would come directly into our EMR. They would populate in the provider's in-basket, the provider would review it, and appropriate action would be taken from there. So there was a lot of cleanup associated with our health information exchange data. So step 1 was getting the list, and then step 2 is all this data cleanup. So a lot of patients had a completed colonoscopy, but it wasn't documented in their health record. Likely they self-referred and went on their own, and we didn't know to follow up on those procedures. Second, the order was completed, or the patient completed their colonoscopy, but it wasn't documented correctly in their chart. So there's 2 areas in our EMR where you need to document the colonoscopy. It needs to go in surgical history, and then it needs to go in the health maintenance portion of their chart, which is the area, again, that alerts our care teams to services that our patients are due for. So if a patient had a positive FIT test and that FIT result comes in, that automatically updates that section and resets that patient's health maintenance alert for 1 year. However, after having a colonoscopy, that alert needs to be changed so that the patient is screened via colonoscopy with the appropriate time frame based on the findings of the initial colonoscopy. Then we used the monthly list of all the colonoscopies that were completed in the community to finalize data cleanup and really just make sure that we had all the information updated in our chart. So what we would do is we would run our UDS report, and then we would match it to this report that we were getting from our health information exchange. And any patients that hadn't met the measure, but we had a report for, we would go on in and update. So to give you a little bit of an idea of volume as far as how many HIE reports we received and how that affected our screening rates, in 2016 we received almost 31,000 reports via HIE. 867 of these were colonoscopy reports. 83 were reports that we did not have before. That's about 10% of our patients with a completed colonoscopy, but we did not have any record of. This slide talks about the colorectal cancer screening population at Open Door. So as many of you know, the CRC population includes patients ages 50 to 75 with 1 medical visit within the year. To meet the measure, patients must complete one of the following methods: fecal immunochemistry test or FIT, or a fecal occult blood test, FOBT, within the measurement year, colonoscopy in the last 10 years, or sigmoidoscopy within the last 5. And sigmoidoscopy is not available in our area, so patients are strictly screened by FIT and colonoscopy. So the chart below shows our UDS screening rate starting in 2014 through 2016. So the total patient denominator in 2014 was a little over 13,000, and we screened about 40% of our patients. In 2015, it increased to over 14,000, and we screened 48%. And in 2016, we again saw our denominator increase to over 15,000 patients, and we screened 57% of them. As you can see, our denominator steadily increased over those years because of the simultaneous implementation of the ACA and managed Medicaid in our area, so our patient population grew exponentially. So this slide here talks about our CRC screening improvement. This shows the screening rate by method. So in 2014, remember that was when we implemented the direct mailing of FIT tests to our patients at our 2 control sites. Those 2 sites are labeled ECHC and HODC on the graph. At all of our sites, not just those, you can see that the patients are predominantly screened by colonoscopy. In 2015, you can see the increase of our screening by FIT at our 2 control sites because we had been involved in the project for about a year at this time. So Eureka's screening rate went from 12 to 20% by FIT, and HODC's screening rate went from 12 to 14. In 2016, we implemented the direct mailing of FIT to all of our clinics, and we also were farther into our HIE implementation, and we're receiving colonoscopy reports from our local HIE. So both the FIT and the colonoscopy screening rate have increased here. However, the proportion of patients screened by FIT versus colonoscopy also increased as a result of our direct mail efforts. Next steps for Open Door as an organization, as far as EMR functionality, our wish list item would be that HIE documents populate specific areas in our EMR and automatically update that health maintenance section of our record. That's a very big wish. That would be our absolute dream. However, we have no idea of the capability of that. And then our stretch goal, like many others, would be to have 80% of patients screened by 2018. Thank you for your time. I've provided my contact information here, so feel free to reach out if you have any questions about my presentation.